Record. Here we go. Good morning and good afternoon, and welcome to the fifth Wednesday webinar for Wellbeing in the series that is created and presented by the Child and Family MHPSS Thematic Group under the IASC MHPSS Reference Group. My name is Marie Dahl. I'm the director of the MHPSS Collaborative and also the chair for the Child and Family Group, together with UNICEF. Today's webinar is actually the second for the day. This is the first time we're doing a morning and afternoon one to give more people a chance to listen in. It's brought to you by the Child Protection Area of Responsibility, Global Education Cluster, UNICEF Education Division, the Norwegian Refugee Council, Save the Children, and UNESCO. And we'll get to hear about challenges and solutions regarding the coordination of MHPSS across child protection and education interventions. Before we start, just a little bit of housekeeping. This webinar is recorded and it will be available on the landing page for the series and sent to all registered participants afterwards. We encourage that you introduce yourself, just the name, organization, and location in the chat box. And we will also encourage that throughout the webinar, you can put any questions you might have for any of the presenters in the Q&A box. If you can't see the Q&A box at the bottom of your Zoom screen, there might be 3 dots you can click on and you'll find more options. So Q&A should be there, and you're welcome to put in a general question or a targeted question to the speaker that you want to address. So you'll be able to use the chat for your introductions and for comments, but you won't be able to speak because it's a Zoom webinar version. Let's look at the agenda for the day. So we're going to start by hearing from our colleagues Koen and Elena, a bit of a flying and an intro to the importance of coordinating MHPSS across child protection and education interventions. So that's kind of a scene setting part. And then we're going to move to hear 3 case studies from different actors, one from Syria, one from the Sahel region, and one from Fiji. And then we'll land in a Q&A session. So let me introduce the 3 first speakers. Koen Sevenens, he's an MHPSS specialist working with the Child Protection Area of Responsibility for the last 6 years. He's a child and adolescent psychologist with over 20 years of experience working with children in emergencies and coordination of humanitarian aid. He will hand over to Elena Merseli. She's a senior EIE specialist and a global lead, the new one for UNICEF. She's been working for also over 20 years in education, on leadership roles in DRC, Kosovo, Afghanistan, and Ukraine, among others. We're also hoping that we'll have Ala Hameid, an education coordination specialist from the Global Education Cluster, who is a rapid response team member for MHPSS. Join us later. She's, however, based in Lebanon, so it might be that she'll find it difficult to connect under the current circumstances. But Ala has been working with Save the Children for the last almost 10 years, providing education and social and emotional technical support. And 2 years ago, she joined the education cluster, and she has been working, supporting specifically the Middle East region on education emergencies. Wonderful. With that, I would like to hand over to Koen, who's going to be facilitating the start and the end.
Thank you, Mary. Good morning, good afternoon, good evening, everybody. This morning we had a wonderful webinar as well, and I'm sure that this one will be equally good. I'm also particularly happy that I see Ala in this session from dialing in from Lebanon. Really, our thoughts are with you in these difficult times. Anyhow, let's go. The cluster system, humanitarian cluster system, the coordination system was born in 2005. And yeah, it's a business model actually in which we divide all the whole human landscape into different sectors. We have WASH, we have health, we have education, we have child protection, GBV, harm, close, and property, and so on. And that's all good and well. The system, that's wonderful, right? but it has some non-intended effects. And one of the non-intended effects is that every sector started to work in silos, basically. We started to look internally inside our own sector instead of working across sectors. We started to have as many beneficiaries per sector as possible to explain to donors and to the general public that we have a reason of existence. And so we were afraid, basically, to also transfer or share, in a way, also beneficiaries with other sectors. Mm? But now I think it's time to change this as well, because I will first talk now briefly about child protection, and then I will talk about education and why we need each other. When we look at child protection, what is child protection? There are different definitions. One definition is that we exist because we want to prevent all types of abuses for all children. Another type of definition has to do with the rights. All children should have access to their rights. But regardless of what definition you take, there is one key word, and that key word is all. All children should have access to the right, should be helped in preventing abuse, and so on. The all is key. Yet, when you look at child protection, we're not doing that great, right? Because we work in silos very much. We basically only reach in some countries 2%, in some countries 5% of the population. We have mechanisms like child-friendly spaces, PFA, and so on. And we use these mechanisms, of course, to help children, but also to increase the number of beneficiaries. But is that the right thing to do? Is that what we should do? Now, when we look at education, on the contrary, education has a coverage that is much higher. In some countries, more than 90%, and then in some countries, it's a bit lower, like Central African Republic, it can be like 60% or something, but it's still way higher than child protection does. And remember, for child protection to reach all children, we should have many children as possible on the radar, right? So what should we do? We should actually cooperate with education. We need education to have all the children on the radar. Now, when you look from education point of view, okay, we know that the main focus of education is not so much the protection, but more the academic side, right? And that's okay, you know, regardless of that, the focus, that the focus of academic sector actors is still the academic side, is that they still provide, schools still provide the predictability, the safety, the routine that children need to heal from difficult situations. Also, we know that teachers have many things on their plate, right? And in the field of MHPSS, maybe they can do some PFA, that's good. Maybe they can do some mentoring as well. But of course, they cannot be psychologists for individual children, right? But what they can do is also identify children with more needs. And these needs, these children with those needs can be referred to child protection actors. We have case managers, we have social workers. So as much as child protection needs education, education also needs child protection. And that has to be clear from the outset. Often people ask me, okay, you don't want us to do child-friendly spaces in child protection. I said, no, only in the beginning. But then what should we do? Well, the answer is exactly that. We should work together with education, because the predictability, the routine, the safety, everything is provided by education, and they have a much higher reach, right? That being said, I will hand over now to Elena to continue the mutual love that we should have for our sectors. Elena, on video.
She's on her way.
Good afternoon and a warm welcome to everyone joining today. My name is Helena Mursoli and I have been working in the education sector in both emergencies and development sector for over 20 years. Most recently, I joined UNICEF as a Global Education in Emergency Lead, and prior to that, I served as Chief of Education in DRC. I appreciate your understanding that this message is recorded. Today, I would like to briefly share insights from my experience on how cross-sectoral coordination, particularly between education and child protection, can significantly enhance mental health and psychosocial support services for children and adolescents. I'm sure Cohen has already highlighted how crucial coordination between the education and child protection sector is. In my own work, particularly in emergency and protracted crisis setting, I have seen firsthand both the opportunities and challenges of coordinating efforts. I have worked in many countries affected by crisis, conflict, and emergencies, and whatever the context, I have found that linking protection, education, and MHPSS is the most effective way to ensure children can access quality education in a safe environment. As we all know, education is not a service that can be disconnected from other needs children have. It is crucial that the approach responds to children's needs, especially in crisis-affected countries that are cross-sectoral. Child protection and MHPSS are among the key services that enable children to learn and thrive. One specific example of integrating protection, education, and MHPSS is one developed by UNICEF in DRC. In response to the needs of children affected by conflict in eastern DRC, displaced children were hosted within communities whenever possible. To ensure continuity of learning, UNICEF, with partners and in close collaboration with the Ministry of Education, set up temporary learning spaces. These spaces provided teacher training and distributed essential learning and teaching material. However, it quickly became apparent that many children affected by conflict were struggling to learn effectively due to unmet MHPSS needs. Teachers who were often also displaced also faced challenges and required additional support. To address this, teachers were trained to identify and respond to teachers' specific mental health needs. Working closely with trained social workers and therapists, child-friendly spaces were immediately established close to the temporary learning spaces. The proximity of both centers allowed children's specific needs to be better met. This integration provided more holistic support for children affected by crisis. However, we faced challenges such as the rapid increase in the number of children attending both the temporary learning spaces and the child-friendly spaces, and the lack of qualified staff to respond to the needs. This example underscores the importance of effective cross-sectoral coordination, which can transform how we address the MHPSS needs of children, teachers, and caregivers. By collaborating, we can build more resilient education systems and provide integrated support services. Thank you for your attention. I will now pass to Alain.
Please go ahead, Alain, as we get your presentation up.
Hi everyone, and excuse me for not opening the camera. I'm Ala from Global Education Cluster, and I will be talking about education and coordination and how we need as well CP AOR as much as we need also other sectors, but in particular child protection. For GEC, learning in emergencies, we focus on foundational skills or foundational literacy and numeracy, as well as social emotional learning. Why? Because we need, or we want to emphasize on the importance of the life-saving learning in the critical times where teaching is impossible and getting children back to learning is impossible. So we focus on the minimum as foundational literacy and numeracy and social emotional learning. All of this is to protect the children and also share with them information on how they can protect themselves during the emergencies. The example that Kun gave and also Helen is that we give the service, yes, but what else? Us as education, imagine you are going to a hospital, access alone is not enough. So you need other specialties. We focus on academic learning and teaching, but our teachers, caregivers, and children need other services. They cannot focus if they are hungry. They cannot focus if they are under stress. They cannot also progress, and they need to learn skills that help them cope. Second slide, please. The slide before this one. Thank you. The other slide. Yes, thank you. So we do know the linkages with MHPSS by theory, by global guidances, by policies, by definitions from big actors, big education actors and donors like UNICEF, ECW, GPE, GEC. We all advocate to integrate MHPSS in education, SDL as well, and we know that it's essential for children's well-being and for learning and resilience. This is because we see the child as a whole child, starting from cognitive domain, language, social, emotional, and physical development. So these approaches or definitions is supported by global means like INEE minimum standards, where they recognize that SEL is important and core activity to be given inside the classroom. But beyond that, we need other support to our teachers in capacity building, to refer to identifying children and giving them specialized services or focused PSS or any other layer, because we operate on layer 1 and 2 from the MHPSS pyramid. So across these layers, we cannot leave the child alone. We need the cross-sectoral collaboration. We need the child protection area of responsibility to filter what we refer and identify through our teachers, and them also giving the extra layer of services for children. Also, we have the MHPSS MSP or minimum service package that highlight SEL and MHPSS activities in education through both if we are operating in non-formal or formal education. Second, the other slide. How we support clusters, education clusters, and integrating MHPSS and EIE coordination across the humanitarian program cycle. We do have minimum suggested actions across the HPC to integrate MHPSS. I added some of the examples that might need, that definitely needs collaboration with other sectors or actors, like the first one is to update our secondary data review so we can use this information in the humanitarian needs overview. One of the challenges is the funding. So we can't in education fund everything, and we shouldn't. We can take this information from, for example, from the MHPSS Technical Working Group, from the CP sector in country or AUR, so we can draft the response or the strategy, mirror the needs in country, the needs of children, teachers, and caregivers. We also advise the cluster coordinators and with their partners to choose, identify matching MHPSS activities and indicators from the minimum service package that align with the needs in country. We also advocate to include MHPSS in multi-year programs such as ECW Education Cannot Wait. This allows us to build or to collaborate with the development actors and ensure that MHPSS activities integrated in education is getting funded somewhere, but how it needs to have coordination with other actors, because as mentioned at the beginning, we operate only in 2 layers, so we can't give all the services. For example, multi-layered MHPSS intervention through referral mechanism with the child protection AOR, health, nutrition. This is one of the activities added in one of the ECW grants. Similar to teacher capacity building, caregivers awareness, we do depend heavily on child protection area of responsibility and MHPSS actors to support education actors, teachers, to train them so they can deliver quality services to our children. Thank you.
Thank you so much, Ala and Koen and Elena. Great to hear that those different perspectives in our first part of this webinar. And we're now going to move from the global level and the more overarching frameworks to some case studies from a number of different actors where they'll share a bit what the intervention is that they've been part of, what's working, what's not working, and how can we approach challenges. So we're going to have 4 speakers with us, one with a recording, but the rest one's live. So first out, we have Camilla Lodi. She's a global psychosocial support lead of Norwegian Refugee Council, who oversees the NRC's classroom-based better learning program implemented in 34 countries to date. She's an education specialist with over 20 years of working to manage large and complex social protection education programs. She's joined by her colleague Fabio Mancini in the Middle East and North Africa region, who works as an education advisor, supporting 8 countries in that region. He's an education specialist with more than 10 years of professional experience designing interventions in humanitarian development aid. And then we'll have the chance to hear from Anta Fall from Save the Children. She's a regional MHPSS advisor in West and Central Africa, with over 20 years of experience working on children's rights and protection, including issues on adolescent and reproductive health, GBV, and social norms and migration children. And lastly, Camille Evans will join us, currently an independent consultant, formerly with UNESCO. She's a clinical social worker with also over 20 years experience working with child protection, gender-based violence, and emergencies. And she's an MHPSS specialist working with NGOs and UN agencies, mostly with a record from Africa and Asia. Her last mission was with UNESCO in the Bangkok Regional Office, and we look forward to hearing about the Fiji example from her. So with no further ado, let's move over to the first presentation. And this first little part before Fabio comes on is a recording.
Thanks, Mary. So good morning to everyone. Today we will present a case study on the institutionalization of a psychosocial support social emotional learning program within the formal school system in Syria, which ties into the broader themes of this webinar. This case highlights the need of synergies between child protection, education, mental health, psychosocial support, as well as collaboration across different organizational mandates. Before diving into the specifics of the Syria case, let me briefly explain this program we're referring to, which is the NRC's Better Learning Program. We call it BOP, and we can go to the next slide. And this is a flagship classroom-based intervention. As Mary mentioned, is implemented in 35 countries, aiming to help children and youth in crisis-affected communities recover from traumatic events, improving their learning conditions. It consists of 3 components. I see the green one, BOP1, is a general classroom-based approach targeting all children. BOP2 is a small group intervention for academic underachievers to support resilience. And BOP3 is a more specialized approach addressing trauma-induced nightmares. So you can see on the IASC pyramid, BOP1 and 2 engage community and family support through teachers, while BOP3 requires trained counselors and psychologists, linking to specialized services provided by partner organizations. As part of our guidance when implementing this program, it is recommended to have active referral systems in place to address other mental health PSS needs not covered by this program. So in the next slide, alongside Jordan, Lebanon, and Palestine, where the institutionalization began approximately 12 years ago in different countries. The others, like Syria, Kenya, Burkina Faso, and Poland, are also receiving technical support to embed psychosocial support, social emotional learning in their education system, ensuring long-term sustainability. So I think it's important to highlight the definition that we give to institutionalization, which is a process which varies by country but shares common elements. So we have compiled a regional institutional toolkit, but more importantly, the institutionalization is about embedding practices within organizational government system to create lasting change, requiring long-term commitment and adaptability. So as our education specialist from Syria is unavailable due to staffing transition, I'll pass over to my colleague in the MENA region, Fabio. Just before that, I'd like to share a link. We will put it in the chat on the latest blurb co-signed by NRC Secretary General and UNICEF Education Director, showcasing the impact of this program, just if one wants to know a little bit more about why and what it helps. Over to you, Fabio. Thank you.
Okay, good afternoon, colleagues. I will elaborate a bit more what happened at field level in Syria toward institutionalizing PSS through NRC Better Learning program. So yeah, the previous one, if we the previous one, please. So just to give a bit thank you, an overview. So the journey between UNICEF, NRC, and the Ministry of Education toward institutionalizing and enhance the PSS component in existing Ministry of Education plan started in 2022, and in consultation with the Ministry of Education, with UNICEF and other stakeholders, what was noted at the time that there was the possibility to further expand and strengthen the existing social emotional learning package of the Ministry of Education by really adding new component. And this was the reason why the different actors start exploring the possibility of integrating and expand the package by adding specific components which will allow the really teaching and non-teaching staff to increase knowledge and competencies to support children in school. It is important to say, and link it to the topic that we're discussing today, that one point of reflection when we were exploring the possibility really to move forward with this initiative was really the presence of counselors inside schools in Syria and their capacity really to address protection need. Obviously, a set of skills were already in place, but the analysis was around how these skills can be further supported, what could be done to really make sure that even in schools, students are able to be supported and with protection related issues. And this is really the key point that, again, that's why I was emphasizing earlier the important that this initiative had in engaging teaching, not teaching staff, but especially counselor inside schools, and enhance the protection, child protection aspect inside schools. Moving to the next slide, we are here. We are presenting the approach. We used a phased approach where the starting point was really a joint conversation around existing curriculum and comparing and looking at the social emotional learning package of the Ministry of Education and NRC Better Learning program to better understand complementarity and to come out with a contextualized package. This phase, it's important to say that there was a very heavy engagement of the National Curriculum Development Department of the Ministry of Education, and also engagement of UNICEF colleagues together with NRC expert. So as soon as the package has been developed, the next phase was really focused on teaching and non-teaching staff capacity building in order really to enhance specific skills. And this included, as I said, really a particular focus in school and engagement of counselors. This training, was really mainly these 2 phases led really to the development of this pilot phase, which took place in 2 areas in Syria, in Aleppo and rural Damascus, with the goal then to really analyze the impact, to expand the program and embed within the Ministry of Education, with the ultimate goal really to integrate in national curriculum. Going to the next slide, here we are really underlining the importance that monitoring, evaluation, and learning played and will play in this throughout the process, with also kind of contextualization of tools such as the student learning in emergency checklist tool that is actually, a research-based tool designed to measure the impact of the program on student well-being, but also their capacity and progress in terms of learning outcome. At the moment, the tool is under analysis, contextualization together with the Ministry of Education, and will be used even more to understand the overall impact of the program and to guide the institutionalization process. Obviously, and moving to my last slide, the journey, as usual, had challenges, but also we were able to gather lessons learned. One of the main challenges, given also the effort that the initiative had around the counselor, was the limited presence of counselors in schools in Syria, something that was also, and it is noticed by the Ministry of Education, and this is also the reason why the initiative targeted also non-teaching personnel in terms of school supervisors and administrators. However, this was a challenge that the program was trying to overcome. The administrator also identified as an alternative the availability, given the workload in some instances was limited, which was another limitation, I will say it. And then finally, other challenges are more related bureaucratic aspect when we are talking really institutionalizing something within a Ministry of Education. Nevertheless, important lessons learned, as I said, have been gathered, and was clear until today, as of today, that it is very important to ensure engagement of all actors at different level, so central level, but also directorate level, governorate level, and school level, really to have to start from the same point, being on the same page, and go toward the same objective. Another important lesson learned is really the engagement of protection actors from the beginning, expanding a bit the network, but also the linkage at school level. I think that this could be enhanced, increased, and strengthened in the future, and underlining the necessity really to link different sector also at the school level. And finally, as I said, it's important really also to further analyze how, by addressing protection issues and supporting the well-being of students, how these aspects are really leading then to learning opportunities to improve the outcome. With this, I conclude. Thank you, and ending the floor to the next speaker. Thank you very much.
Please go ahead, Anta.
Thank you, Mary. Good morning, good afternoon, or good evening, everyone. I'm very happy today to have this opportunity to share Save the Children experience of working across sectors to protect children in escalating crisis in the Central Sahel region. It's a 4-year flagship programmatic partnership funded by ECHO. It provides education in emergency, child protection, MHPSS to crisis-affected children through a holistic and regional approach. Slide, please. So the program is intervening, as I said, in Sahel, more precisely in Mali, Burkina Faso, and Niger, where in terms of context, it's very challenging with the presence of unidentified armed groups and all the negative consequences on population. Also, we have 22% of population in need of assistance, while we are struggling to cover those needs in terms of food insecurity, school being closed, etc. Child protection issue also with grave violation of child rights, such as abduction, sexual and gender-based violence, etc. In terms of humanitarian access, it's quite complicated to reach the communities and children in needs. And in terms of political and diplomatic crisis also, last year we had a lot of coups leading to departure of some basic donors. So we are now facing like an evolving crisis while the attention of international community is reducing. Slide, please. So in terms of response, the real mechanism is one of the cornerstone of this program. And the REAL is the French acronym for Rapid Integrated Response for Children. And it's also mean to love in French. So once the alert is launched in a country by the mobile team, we have this multi-sectoral assessment who are also done by this mobile team. And the idea is to integrate the program into the formal rapid response mechanism in place where they are in place, and to be able to identify needs in terms of child protection, education, mental health and psychosocial support, but also other issues. If the real response is declared to be set up, it's done through what we call transition space, where we have trained staff and volunteers, so community-based facilitators, who will provide to children of different age group different sessions, once again on education, child protection and MHPSS, to ensure that those children benefit from activities that will help to improve their resilience, their well-being, but also their learning and outcome, and also child protection issues. So doing that, it's important that we ensure that we have mapped key actors around these 3 sectors, and we have set up a referral pathway through the mobile teams, but also through community-based organization and state services where they are in place, to ensure that children benefit from a holistic approach through case management. And also the profiling of these children is done through holistic assessment tool, so the HAT, that is used to identify children and decide if they will be enrolled in this transition space or not. After the 3 months of real implementation, we use the HAT tool to decide if the children will be transitioned into a formal system, so education formal system, or a temporary education space, can be accelerated school classes, catch-up classes, distant education, or in some countries, Quranic schools. Slide. Yeah, so just to emphasize that we are using a manual that is based on different approaches, such as back to school approaches, the team up, girl decide, safe families, and safe school common approach. And yeah, next slide. Just to flag that MHPSS is really at the heart of the real response. And we are really focusing on identifying, responding to the needs of children in distress. And to do so, we strengthen capacities of all actors to identify children in distress, to be able to provide psychosocial first aid as quickly as possible. And also child participation is very important. And we do so using the I Support My Friend manual, which is a peer-to-peer PFA process where children are trained by, it can be teachers or community facilitators to be able to provide support to their peer, but also to alert an adult or refer the children to existing services. So it's important to build capacity of social workers to provide MHPSS and to facilitate referral and care for mental health related services. Let's go to the next slide. So in terms of what is working, this transition space together with intersectoral services are really key to build self-esteem and resilience into return to learning program. So profiling also children for individual orientation is important to the program. And also giving or creating opportunity to observe, identify, and refer children to social services using case management process. Increased community buy-in is also important at the beginning of the program. And of course, working with formal system to enforce, to reinforce the system instead of having parallel system. In terms of challenge, next slide. As I was mentioning at the beginning, in some contexts, it's really hard to access humanitarian, to access population in need and children in need. And it's also prevent us from efficient coaching and monitoring. Measuring well-being is also another challenge and its effect on children's learning ability. So we really need to elaborate tool which can allow us to do so. We have high number of displaced children compared to the number of trained human resource, which is also a big challenge for us, and insufficient education alternative option in most remote places. So that's it for me, and I open to answer to question if needed. Thank you.
Thank you so much, Anta. Next, we have Camille.
Hello, everyone. I'm going to present on a pilot that was done in Fiji. So this is not an intervention, but a review and assessment tool that was developed by UNESCO and some other collaborating partners, including UNICEF and the World Health Organization. Next slide. Just to give some context for Fiji in terms of emergencies, Fiji is located in the South Pacific, and so it's located in one of the most disaster-prone areas in the world. It's subject to earthquake-induced tsunamis and landslides, and it's also very vulnerable to climate change effects with rising sea levels and other weather-related hazards. So, for example, there were 5 tropical cyclones between 2020 and 2022, and that was in the midst of the COVID pandemic. So along with having to respond in terms of COVID, they also had to respond to the tropical cyclones. And what happens during these emergencies obviously are school closures, but also displacement due to relocations of families. Next slide. Just a little bit on the review and assessment tool. So it's called RAMIS for short, and that stands for Review and Assessment of MHPSS and Education Systems. The structure of the tool is an Excel sheet that uses a traffic light system. And what it looks at is different indicators looking at the overall system for MHPSS in schools. Looking at the Ministry of Education as sort of the lead, but also looking across at other sectors such as social welfare, child protection, to look at their input. So it looks at the status of different activities. It looks at the comprehensiveness of the activities and the planning. It also includes a tab for education and health data, and it's meant to be used to plan, debate between sectors, and also to advocate for addressing the needs of MHPSS in schools. Next slide. The tool itself has 4 main areas. So the regulate thematic area looks at laws and policies. The prevent looks at the curriculum design, the school environment, and the psychosocial environment. Respond looks at things like school counseling, the referral pathway, case management, and promote looks at advocacy, communication, community and parent engagement. Next slide. So in terms of the challenges, again, just to talk through the RAMIS process, it's an opportunity to bring actors together from within the Ministry of Education, from within, in Fiji's case, the Ministry of Women, Children, and Social Protection, the Ministry of Health, to look at how MHPSS in schools is organized. One of the things that came out in these discussions is that the education in emergencies focal point, which was appointed, so there is an education cluster, but they operate very separately than school leadership, curriculum and assessment, and the PSS structures in schools. So meaning that there might be learning that's coming from either the child protection officers or the school counselors or school leadership, but it's not being shared with the education cluster because they're more focused on the physical environment of the school and coordinating those kinds of services. So there's opportunities where there's mislearning. And an example of that is a number of activities that were done in terms of disaster preparedness, learning that was gained from schools around the pickup of children, but that wasn't passed on to the education and emergencies coordinator. So there's this understanding that there's some real risk that can happen during an emergency with, I guess, congestion that would happen on the evacuation route, but that hasn't been shared. And that's something that will be left to parents and teachers and children to sort of manage on their own unless more coordination and planning is done. Another issue that came up in terms of challenges is it has to do with the legislation and sort of legal framework within Fiji. So very clearly, the Ministry of Women, Children, and Social Protection, they're responsible for child protection, and there's a focus on any child that's identified as at risk. So any child with an MHPSS need would be identified as risk, and they're immediately supposed to be referred to child protection or to the social welfare department. What that does, however, is it overwhelms the social work department so that they're not able to follow up on each child, and it means that they are limited in early intervention and prevention activities that they can do because they are mandated for all other actors to refer to them, and the other actors are not able to follow up independently. And so this was something that was discussed, and this is something that they're wanting to address in their sort of legislation framework, but also in terms of recognizing the role for other sectors. Related to that is, I think Kuhn mentioned this before, that the different sectors are siloed. in their understanding and their intervention for MHPSS in schools. So you have the Ministry of Health that is focused on mental health, Ministry of Education, focused on some psychosocial support, and then child protection officers within schools focused only on child safeguarding for more imminent risk cases. And again, there's minimal coordination and harmonization of policies. Lastly, a challenge that came up a lot was this idea that MHPSS was somehow related to school discipline and was for children from broken homes or that had bad behavior. So that contributed a lot to stigma, which again was a barrier for early intervention and prevention. Next slide. Some of the strengths and opportunities that came out of the piloting of the tool had to do a lot with bringing people together from the Ministry of Education, from the Ministry of Women, Children, and Social Protection. A lot of them said that was the first time that they were brought together. So it meant that we could have the education cluster, the emergency focal point from the Ministry of Education actually in attendance, speaking to some of the school leadership, the child protection officers. There are also 35 teachers that are trained as school counselors, so they can also have conversations across different ministries to understand some of the issues around the referral mechanisms. Civil society was also there, so this was a strength. And there was a recognition that there was coordination that needed to happen among all of these different actors, as opposed to just within one particular sector. There was a recognition that psychosocial activities, along with physical activities, was one of the main enablers of education continuity after disasters. That also came out in a Save the Children study that was done. There was a recognition, as I mentioned before, around the duty of care for child protection. But there's also new legislation, and from the discussions, there was an understanding that there needed to be more of a focus on spreading that mandate so that other actors besides social welfare can act to deliver early intervention services or make referrals, and that a focus on prevention and multi-sectorial working was needed. The Ministry of Health also made some commitments around being able to provide technical support around developing SEL or family life education curricula, so social emotional learning. And health promoting schools is also very popular and well received within schools. So integrating some MHPSS promotion and well-being content within those curricula was something else that was identified. And the Ministry of Health is also responsible for the school health policy. So again, hearing from the different actors, understanding the need for focus on prevention. So this was also brought together and was one of the outcomes of the assessment. The last thing I'll mention is that going into the process, there was a focus on counseling as being the equivalent of MHPSS in schools. And what came out of a lot of the discussions after we sort of talked about the tiered approach was a recognition for the need of multiple actors, and for these multiple actors to have a coordination body and for policies to be harmonized. And so they particularly recognize civil society, faith-based organizations, but also the need to engage communities and parents. Next slide. So what you see here is actually the results of the pilot that we did using the RAMIS tool. And so these are all the indicators that go along with the thematic areas I mentioned before. So you can see there's a lot of amber, which basically shows that it's latent, not quite developed, but something that has been put on the agenda to be developed further. A lot of yellow, and so things that may have already started but need further development. Some green around these physical school environments and some of the policies as well. And what this does is gives the different actors that are part of the process an opportunity to prioritize and perhaps look at an action plan of where they want to focus, looking at the responses from the different actors as to where they are now. So they have sort of baseline, and then they can figure out how to go forward. So I'll stop there and just hand it over for questions.
Thank you, Camille. Thank you, everybody. Yes, I did not see a lot of questions in the Q&A section, so let me just put this question here forward. Camilla, last time that was in Fiji and also in West Africa, and I saw that in some classes you really can have huge amount of students. So it's easy to deliver some social emotional learning when you have like 10, 15, maybe 20 students in a class, but when you go to 40, 50, how do you do that? You know? I wonder if any of you has to say something about that. Yeah, because even classroom discipline, behavioral management is really an issue, and then you hear complaints about teachers using physical violence as well, right? Yeah. Camilla or Anta?
Maybe if I just a little thought on that. It really, when I was mentioning this challenge around number of human resources versus number of children in need, that was exactly the case. And we think that one of a strategy can be to have like parents groups or communities groups linking with teachers to be able to provide these MHPSS service, because for the time being, it's quite impossible for the teacher to provide quality response and service to the number of children they have in the classroom. So maybe one thing would be to really have this collaboration with the community groups and the community-based facilitators to be trained so that they will be able to support teachers and provide basic MHPSS services to children.
No, thank you. I really like that you answered the question with a possible solution. That's fantastic. Camilla, you also want to go?
So yes, I think very similar to what Anta has said. What is being explored a lot within Fiji is the role of faith-based actors. So particularly when I was doing focus group discussions, you would hear about the role of certain elders that were sort of teachers that are retired now, but may have a prominent position in a faith-based organization. And so they would come in and be able to mentor some teachers, but also they were looking at how they could also mentor students that were having difficulty. And so it's a way to be able to support the teacher in terms of passing on knowledge, but also looking at what other kinds of supports besides counseling, more sort of group types of activities. It'd probably be related to a particular faith as well. So there'd probably be some teaching around whether it be Christianity or Islam or whatever faith was in that particular school. But they were seriously looking at how could they do more training for those that were already there in the school and then bringing in more. So maybe doing PFA training for them and finding ways to integrate them in schools. So that was another way that they were already thinking about trying to support teachers because, as Anta said, it's just, and you've said, it's just impossible with such large classrooms to really pay attention to individual needs.
Thank you, Camilla. Thank you for sharing that as well. I think we just have 2 minutes left. Maybe just quickly a question for Fabio as well regarding BLP2 and BLP3. BLP2 is delivered by in schools, right? Could you say something about the coordination between BLP2 and BLP3? How does that work, actually? In BLP3, you said specialized service providers. That can also be child protection actors, case managers?
Absolutely. I think that BLP3 is indeed a level of our program where coordination with child protection actors is really needed. This doesn't mean that also in other level this is less relevant. At all level it's relevant, but being a very specialized level of the program that looks at nightmare, I think that indeed this is the collaboration between the sector is quite needed. Now, the correlation between the BLP2 and the BLP3 is really more related about the capacity of students to deal with specific situation, once again, to then improve their learning outcome. So, in fact, the name right, it's really better learning program, because that is the overall goal, to support students in progressing in their learning while addressing specific protection needs, but also more in general the psychosocial aspect and the well-being.
Right, thank you. It's a fabulous program. Thank you so much. Mary, I think we have like 30 seconds left. Do you want to say some meaningful closing words?
Thank you so much, Koen, and thank you each and every presenter today for sharing your experience and your learning. It's been really interesting to hear you all. As we conclude for today, both the recording and also the slide deck will be available on the landing page. I put a link to that in the chat box, and there will also be a list of resources for some of the things we talked about today that might be helpful and useful for you in your work. Also, just lastly, wanted to advertise that the upcoming webinar, there is another one called a Double Wednesday. It's going to be focusing on monitoring and evaluation and research on child and family MHPSS. I think it's an area that's two areas that are very interesting, and because of not being wanting to short for time, we're going to do two different ones. So the 30th of October and 6th of November, those two are planned for. It's been a pleasure and a privilege to be here with you today, and we wish you all a great afternoon and evening. Thank you so much.
Thank you, Mary.
Bye-bye.
Goodbye.
Goodbye.